Good afternoon, everyone. Madam Clerk, would you do a roll call, please?
Yes. Supervisor Angus? Supervisor Johnson?
Present.
Supervisor Gould?
Present.
Supervisor Watson?
Present.
Chairman Bishop?
Yes, present.
We have a quorum.
Okay, I'd like to call this meeting to order. The Board of Supervisors may by motion recess into executive session to receive legal advice from the board's attorney on any item contained in this agenda pursuant to ARS 38-431-03. So we'll begin this morning with the regular agenda. This will be a discussion on possible action, an update from the County Public Health Director to the Board of Supervisors regarding recent issues, actions, events, and county responses regarding COVID-19 updates and taking necessary actions based upon these updates. So, Denise Burley, we'll turn this over to you.
Madam Chair, members of the board, thank you. Some updates. I believe if you've seen the hospital capacity report.
Is your microphone on?
Thank you. Thank you. Madam Chair, members of the board, appreciate your time this afternoon. I'll go through the agenda here very quickly and then leave some time, I hope, for questions. Okay. So the hospital capacity report that you received this morning, I believe, shows that there's no issues really in 3 of the 4 hospitals. The exception might be Valley View and Warmsea, potentially, where you look at ICU beds available. It looks like at Valley View there's only 1, and then in Warmsea there are 4 out of 32. So it looks like their ICU capacity is sort of right on that border there for them. Both hospitals I know have prepared for surge, so they're ready to open up additional spaces if need be. So I know that that's something that they've already taken steps to ensure. PPE, we have not seen any major issues with personal protective equipment, and we continue to reach out, and so do agencies, with requests. And at this point, I believe the masks have come in, that large shipment. Those are coming in today, I believe, and those will be distributed out to the 4 hospitals, so that will supply them fairly well for a little while. Something that's kind of new to us is that we've received a notice from ADHS that we will receive a Abbott rapid testing machine. And this is coming directly from ADHS. So there are a few counties, I'm not sure exactly how many of the Arizona counties are actually receiving these machines, but this particular machine will come with 24 test kits is all. And at that point, we don't have any additional test kits for that rapid machine. We will receive training on how to use this machine, and at which time we will probably keep it at our facility to start with and work with long-term care facilities that either have cases or outbreaks. And this will keep us with our more, ensuring the health of our more vulnerable citizens in our county. You know, you can go through 24 test kits very quickly. And each time you move the machine, it requires a quality control process, which takes up 2 of your kits. So you have to kind of figure out how you're going to use them wisely and not move the machine around very frequently in order to make sure that you don't burn up your test kits that quickly. We have put in an order for additional kits through the Arizona Department of Health Services, but we've been notified that those are not available at this point in time, and they're not sure when they will be available. So we'll have to wait and see. So we've got to prioritize the use of these test kits, and we feel like this would be a good use of those kits for that population. I did have a question about the service areas on our webpage, of defining that maybe more clearly. So we'll try to do that actually on the webpage and talk about what communities actually fall into that particular service area. And we'll work with IT to get those listed on the site so people can more clearly see what a Kingman service area looks like, what other is in our county, and so on. So We'll try to clear that up. I did reach out to all of the hospitals to talk about their testing availability, and it looks like most of them are not having any more difficulty getting testing supplies. So they are using the matrix. They continue to use that matrix to make decisions on testing, which means that these individuals are generally symptomatic of some sort. And I think I shared that matrix with you this morning, so you have that to refer to in the future. Additionally, there's a prioritization for those test kits, which includes looking at top priority groups would be hospitalized patients and healthcare facility workers with symptoms. Priority 2 are patients in long-term care facilities with symptoms, patients 65 years of age and older with symptoms, and patients with underlying conditions with symptoms, and first responders with symptoms. So it's all symptomatic there for the most part. And then the third priority group is your critical infrastructure workers with symptoms, individuals who do not meet any of the above categories with symptoms, and then healthcare facility workers and first responders, again, not symptomatic, and individuals with mild symptoms in communities experiencing high numbers of COVID-19 hospitalizations. So, you know, based on the testing capacity of each of these hospitals, they're not able to test a lot of people that fit into this third priority group. They are focusing primarily on 1 and 2 based on their capacity. So these individuals mainly are either in the hospital or coming through their ED. So they do test in that way. But people who are asymptomatic, of course, they don't know that they're sick or may not know that they're sick, and therefore, or if they've been exposed, so therefore they're not being tested still. But it is good news to see that the testing supplies that supply chain is improving, so that way we can have testing more readily available in each of these communities. There are some communities who have rapid testing already available to them, and so they are utilizing that where it's possible, but also realizing that the rapid test kits themselves are not as easy to get, and in a little tighter supply than you might find within the compared to the regular test kits. There may be a cost difference for those test kits. A rapid test kit might cost around $38 per kit, and I'm not certain of what a regular test kit runs, but I do believe it's less than that. So, but the rapid test kit, the way it works is that a specimen is collected, put into the machine, and you can actually know a result in about 13 minutes or less. So it is rapid in that sense. We also have to keep in mind that people that have been exposed may not be the virus. I may need Lynn to help me get the language correct to make sure I use my proper terms as far as, is it the shedding of the virus? At that point, the virus may not shed for 2 to 14 days. Is that correct? Yes, yes. Yes, so a person may not develop symptoms for 2 to 14 days. So if you test them within those first couple of days, they may not show as positive. So we have to be, that's why the testing matrix is important, because then we're testing those that are symptomatic and we know that there's a potential that they have COVID-19. Let's see here.
Denise, I have a question.
Sure.
With the rapid test machine, will that be kept here at the county health department or at Kingman Regional?
The plan is at this point to keep it at our facility. What we want to make sure people understand is we're not a testing agency per se. I mean, we will ensure that we can use this machine at our facility, but typically the long-term care facility would collect the specimen, and then we would bring it over to our facility and test it. But we don't have the capacity to just outwardly test everybody. It's not even really just about test kits at that point and the number. So we want to make sure that we're using this machine wisely and prioritize the use of it to these long-term care groups to start with.
thank you.
Certainly. I don't have anything else per se, so I wanted to be prepared for any questions that you might have regarding either the information that I've shared or anything else.
Okay. Supervisor Watson, do you have any questions?
Not at this time, thank you.
Okay. Supervisor Johnson?
Thank you, Madam Chair. Just to follow up on what Ms. Burley just talked about, are you saying that the testing that you have available now, that the state gave you, are you able to say X person is positive?
We could, yes. And we haven't actually received the machine yet. We anticipate receiving it tomorrow with the 24 kits, and then we'll have to have staff complete the training before it can be used.
All right. Going along with that, I'm guessing 24 kits, that's a good idea to keep it at the county if they can collect the specimens and bring them into you. What exactly is a specimen? Blood? What is it?
Thank you. It's a nasal swab.
Nasal swab? All right.
Correct.
Let me go through my list of questions I've got here. In the zip code H6404, we have 27 cases, according to the state's website. When are we going to start releasing more information on the zip codes that we've got more cases on?
Can you specify what kind of information you're looking for on a zip code level?
Well, we said before that, we're not going to release information because if only one person has it, we could find out who they were, and the attorney seemed to think that if you said it was a 20-year-old person that we'd all know who it was. And now we're still using the generalization of, there's somebody from 65 to 85 or 65 to 100, whatever it is. When are we going to start saying we had a male subject, excuse me, 64 years old in the 86406 area?
I think that's a very good question, Supervisor Johnson, and I don't have a readily available answer. I think I need to confer with the county attorney's office and just look at what that number realistically is for any specific area and see if that's what would be reasonable. Additionally, we'll bring in our epidemiologist and nurse division manager to sort of look through that criteria and see where we can start providing more information.
Okay, because we have, I think, the 86401 and 86409 have over 10 cases also, and I think we had decided on before that at 10 cases we'd release more, and hopefully that would, give more information as to, especially when, like say in the Kingman area where we have numerous cases, if they're all in one location, we can say they're related to long-term health care or whatever it is, facility. You also mentioned that we were supposedly getting more test kits from the U of A. Did those test kits come in?
So those test kits through the U of A, I think we're meeting with Representative Biasucci on that, and we're setting up a meeting for this week, which will help facilitate that process. So I'm not sure of the timeline for receiving those test kits for those, and those were specifically for private providers and small clinics. So the hospitals, he worked individually with the hospitals, and we reached out to private providers and small clinics to assess their interest, and then we provided him with the names and contact numbers of those those places so that he could start making that connection for them.
All right. You referenced the information you sent out this morning to the board, but on that I don't see where we got the answer for how many test kits are available at each hospital. Do you have that number now?
I do, actually, and I was trying to compile that actually before the meeting, Supervisor Johnson, but because they answered it in different ways, I didn't have a chance to really compile it in a real logical, simplistic way, so I will try to have that available for you by the end of the day. And it will be by
Thank you.
facility. And I'm still missing Warm Seas information at this point. So I'm sure they're looking into that, but I just haven't gotten a reply yet.
All right. Do we have any illumination on the fact that the Kingman area is testing 4-to-1 over Havasu and 4-to-1 over Bullhead? Is that because there are more people coming into the Kingman Hospital and not as many in Havasu or Bullhead, or is it because of more stringent requirements at Havasu or Bullhead because of lack of testing?
I believe they are all following the testing matrix developed by the state lab. So with that said, if they're following the same criteria, they may just have additional cases locally in Kingman that are they're not experiencing in the other communities. They did, when I spoke with the CEO of Kingman Regional Medical Center this morning, he did indicate that they have a pretty rigorous testing program, and they've really stuck to that. So they are really making an effort to test both their staff as well as those individuals that are coming in through the ED and patients.
Okay. Also, with the growing number of cases, does the health department need more manpower?
You know, that potentially. And where that comes into play is in investigations and contact tracing. Now, the state has developed a draft process and program for contact tracing for health officers and their staff to review. We did receive that late last week, and we'll be discussing that at our health officer meeting tomorrow afternoon. And I think we'll have a little bit more information at that point about what contact tracing could look like in our state. And the effort there is really designed to help those, all counties that are feeling overrun with cases still continue to follow up and do that contact tracing. It just may not be to the same level that we would normally do it on smaller level cases or a smaller number of cases.
All right. I think my last question might be, I thought the board had said that we would have the numbers released on a timely basis, and we've been getting one report a day with multiple people testing positive. You know, for instance, last Friday we had 2 that were put on the state board at 9 o'clock that we had, and we still didn't receive the information until late in the day. Are we going to be able to correct that?
The issue is more the fact that the number of cases, I think it might be important to discuss how the process really works, because it's not as if they get a case and then they can report it to you, because there are a number of steps that come in between that process. And then in the meantime, as you can see, they're getting another case. So they're starting to have different conversations, and then another case comes in. So it's not like they can stop what they're doing to give a report on every single case. That's an inefficient use of their time. And we really need to maximize their time doing these investigations. So I'm not trying to push back against timely reporting. I'm merely stating a fact that in order to use their time wisely, it's easier if if there's a time when they can stop and they have a break to write that report, that's fine. I'm totally fine with that, and they have done that. Saturday, we reported the death in the morning, and we reported cases in the afternoon, but they were working all afternoon. They work all day long.
I understand that they're working all day long, but I would guess that they get one case in and they're following up on that case, and that means somebody else could call in or you get notified, and you put that for the next one to do because no one is more important than the other. But when they finish that one, you know, I'm sure they send that to you to give you a say, hey, we just had a positive, we've done the whole follow-up, we're not going to our next, we've got 4 more in the pipeline here, we're getting them going. Because just it's another side of it is we have the medical side that we have to take care of, and we're just doing the follow-ups, not like we're doing the surgeries or anything. But at the same time, we need to keep the public informed, and I think the more informed they are, especially with cases coming in, they might take it a little more seriously. That was just my point.
Mm-hmm. No, I understand your point. I really do. I'm just trying to use the time that we have for these nurses effectively. And in order to do that, it means we can't do that.
So you're saying you can't give us the information that the board asked for?
I can give you the information, but I can't always give it to you on a case-by-case because there are multiple cases working at the same time. And in order to do that, we have to make sure that we're finishing a process and that we've taken all the steps necessary. So if you would like us to do that, it's just going to take more time to sit back and report back out. And if that requires a press release, that's 6 people that are involved in that press release process. So it's one thing to inform the board, it's another thing entirely for us to present that information in the form of a press release for every case. So I guess I'm looking at 2 different parallel courses here, is whether or not you're talking about reporting cases just to the board, or whether or not we're also talking report to the board and the press releases, which is currently our process today.
Well, and I'm not looking for putting extra work on staff. I mean, you just said that right now you didn't need any more staffing to do things, but the idea that the only thing you're reporting to us is we've got a male age between 50 and 60 in the Kingman area. He's at home. To me, it doesn't appear to be that big of a deal, but those are the only questions I have, Madam Chair.
Supervisor Johnson, if I could just clarify real quick. So our current process, though, is twofold. So one, and we do these basically running kind of concurrently. So we inform the board first of these cases and provide that detail that you're talking about. But at the same time, we're also following through with a press release. So, and that's been my understanding of the expectation to date. So it's not necessarily all that complicated to provide you with the case information. I mean, it does take some time to stop and write this down, and it sort of interrupts the process of the rest of the investigations, but it can be done. But then along with that is this press release process, which then involves the county attorney, myself, the clinical division manager, the communications director, and then we have other staff that update the web page, and then we have other staff that notify staff, because we need to keep our own staff notified of changes in the event that there are questions. So I'm just trying to understand if you're just referring to those notices that we send you, or if you're talking about the entire process.
Well, I guess both of them. But I think it's important for us to get the information out to the public, and I realize we have low numbers, and if somebody's sitting there doing their job, and you probably have more than one person handling a new case, but if they go, I got 7 here, you know, I've got to get through all 7, no sense in doing it. But I'm just guessing that they don't all 7 come in at once, you know, like when we had the 2 that were from the night before. You know, it seems to me those 2 could have been gotten out, and in reality, it makes no difference when we put them out, but it's just the idea that the more information we get, it looks like the county's doing something, because I get a lot of people that are really paranoid when we go 24 hours, you know, waiting for the next release. It's like, is anything happening? Is anything going on?
Sure.
That was all, Madam Chair.
Okay. Thank you, Supervisor Johnson.
Okay, thank you, Supervisor Johnson. Supervisor Watson, you have a question?
Yes, thank you, Chairman. Ms. Burley, I don't mean to put you in some type of a corner. I just would like to clarify for the folks that are watching today and see if possibly you might agree. See if you might possibly try
Madam
to agree.
Chair?
I don't intend to put you in any type of a corner. But in viewing the numbers and the high numbers in Kingman versus Bullhead City and Lake Havasu City, I was reflecting back on the average age of those residents in Mojave County being about 51 versus the state of Arizona 37 and a half. Where in Kingman, we're much higher than 51, and Bullhead City and Lake Havasu City, the average age is less than 51. Would it be possible that the health challenged people in the Kingman area over the age of 60 be a contributing factor to the high numbers that we're experiencing in Kingman? And I'm not trying to trap you. I'm just
Sure.
I'm just trying to explain possibly why, to the people that are watching today, why that might be occurring.
Right. I think that certainly underlying health conditions are a major factor in COVID-related illnesses, so that can certainly be an issue. I also think, based on our knowledge of the circumstances around the recent increase in our numbers, that we have some cases in a long-term care facility, and I think that is certainly an outbreak-related situation, and so we're addressing that, and so you're seeing those numbers increase as a result of that.
And as a follow-up, over the weekend, we experienced a huge number of visitors from California and Nevada at Davis Camp and especially in Lake Havasu City. I don't propose to anyone trying to stop this invasion every weekend, but what effect do you suppose it has on those two communities as far as the pandemic is concerned? Have we seen anything that should raise an alarm to us?
You know, we haven't seen anything specific at this point. I mean, if you look at Lake Havasu numbers and Bullhead City numbers, we haven't seen huge leaps and bound types of increases, but keeping in mind the majority of people coming through and using those resources are also from out of state. And as a result, they're going back to their respective communities after their recreation, and they may get tested over in their respective communities as well.
Thank you.
Which means they wouldn't be counted on our side.
Right. Thank you very much.
Certainly.
Supervisor Gold, do you have any questions or comments?
Thank you, Madam Chairman. Denise, do long-term care facilities or convalescent hospitals have to disclose to their residents or potential residents if they are treating a patient that has COVID-19?
You know, let me check with Lynn real quick and see if she has an answer to that question. I'm not sure what the notification process looks like, if it's one case reported or if it requires multiple cases being reported at their facility. So let me just see if she has an answer. Okay, all right. And Lynn isn't clear either, so we'll look into what that reporting requirement looks like for you.
Thank you, ma'am.
Okay, Supervisor Angus, have you joined the meeting yet?
Yeah, I've been here since probably 3 after. Sorry, I had the wrong number. Okay, thank you, Madam Chair. I do have just a few little tying on what Supervisor Johnson was asking. So when we had only about maybe 20 cases and we asked if we could, and when the first death came in and we asked if we could give the exact address, because I know we all know how important that is, and we were told there are too few cases. And then we had 40. We're still told there were a few. And so you're getting my point here. Now we have almost 100, and we had 4 deaths. Why can't we talk about the exact age of the person who has died? We were told in the beginning that if you had the permission of the family, do we ask them? Has the health department actually asked the families if this is a number that they would release to the public?
You know, in speaking with, certainly, yes, thank you, Supervisor Angus. In speaking, go ahead, I'm sorry, I didn't mean to interrupt.
With all the information that we give, the one I believe, and my constituents are asking me, is the most important, because this is the thing that hits them the most. If Supervisor Johnson's aim is to, with these press releases, which I have something to say about, is to, you know, make people take this more serious, I think that that number, get the truth out, is the most important number of all, actually. So what do you say about that?
And you're asking about the exact age of a patient, is that it? Or just of the deaths?
No, of the deaths.
Okay, all right. So in having a conversation with the county attorney, while we have received, in most cases, permission from the hospital to release that information, we have a different standard as far as public health goes, and I would need to maybe ask her to provide a better, more specific response to that, if you wouldn't mind, and I would be happy to do so.
Okay, well, I'll talk to her, but, you know, it's now getting a little You know, we're getting a lot of cases, and again, what is the number that we're looking for? You can't identify people anymore. We were never really told what that was. And on that strain, how much more are we really testing? So if we're looking for a decrease in the number of positive cases, if we're testing more, that number is really never going to go down unless we give sort of the percentage from when we started. I mean, is that something that you're doing or that we're looking into doing?
You're asking if we're looking into doing additional testing?
No. Okay. I'm saying, you know, we're looking according to everyone's plan and when we can reopen, you know, that the number of positives are going down or that the number of deaths, I'm not really sure anymore because they keep changing every day.
Uh-huh.
But if we're testing more than we did, the numbers are going to go up. So in theory, the more we test, the more numbers are going to go up. So we'll never be able to open because the numbers are going to keep going up. They're not going to go down. If we tested, you know what I'm saying? I mean, we're not testing the same amount of people, so it's not apples to apples.
Denise, if I could interrupt, Supervisor Angus, just so you know, you're fading in and out, and it sounds like you're in an echo chamber. So if you're on speakerphone, maybe it would be helpful if you took it off. It's really difficult to understand your full conversation. We're getting bits and pieces.
Has left the conference.
I think Supervisor Angus is probably going to be calling back in and getting a better connection.
Okay.
So if you understood any of most of what she said, Denise.
Well, I was trying to, so she can correct me if I don't have this accurate. If we continue to increase testing, we have a much better idea surveillance-wise of who is positive, right? And then eventually, when we have the antibody testing perfected, we may eventually have a better picture of who had it, who may have been asymptomatic. And then eventually, we may have more information about immunity level. I think there's a lot of questions around immunity at this point and what level of immunity you have if you've contracted COVID. So there's a lot more questions than answers right now around that, and I think we'll continue to have that for some time, which puts us in a lot of gray area. You know, as far as knowing, you know, we've seen our numbers going up as we've seen increased testing. It's not that we didn't think that was going to happen, we did, but it does paint a more clear picture of what we actually have in our county when we have increased testing, but I recognize that there's a flip side to that, of course, whereas if this becomes the trigger for reopening our community, number of cases, decreases in cases, that does prevent that from occurring more readily, if that's the criteria that's used. Correct.
Okay, Supervisor Angus, are you back with us now?
I'm back. I'm sorry. I tried to take myself off of mute, but I disconnected instead. So I'm sorry.
Oh, that's okay. You're coming in clear now. I can understand you. Thank you.
Yeah, I'm talking on it. Thank you. Okay, and I'm sorry I missed that last thing, but I'll go back and listen for the sake of time. So to go back to the number of press releases we go on, with respect, I disagree with Supervisor Johnson. I think it's confusing and unnecessary and a waste of time. And if Supervisor Johnson's aim is to make the public take it more seriously, I believe, in my opinion, a headline of 9 people infected is more jarring to most people than seeing one at a time, not knowing if it was an old one or a new one. So I'm actually thinking this is a better way of doing it. So that's my opinion, and I wanted to put it out there. And my last thing is about reopening. You know, we did see a lot of people here, and that's not going to stop, and the cities are not going to stop it. So we've got to just work with what we have. And so I don't know if we can talk about, are we going to talk about this meeting, or is that we're going to wait until what? Are we waiting for the governor to say something, or do we take the lead? What are we doing?
Did you want to answer that, or am I answering that?
Actually, I think the governor has put out specific guidelines on how we can reopen the economy. And the federal guidelines, they indicate that testing should be made available for all people with symptoms, all close contacts of current positive cases, if I'm understanding that right, and all people in essential roles like healthcare providers and first responders. So Mojave County is not there yet, so I don't know how we can have a conversation about reopening when we're still short on.
Wait, why aren't we there yet?
Well, we don't have the test kits to test everybody that wants a test. We're still short on PPE, personal protective equipment, hand sanitizers. So
And our case numbers continue to climb. So we haven't
Right.
seen a decrease in our
Okay.
case.
So what are we on track? How many tests are we going to get? Like what? Again, we have no number that we're edging for. We just put out these vague statements about we need this, but we need to know how many, or else people are looking at us and it's like, what are they doing? That's how I feel now. I feel very, very frustrated because again, goalposts keep moving, the numbers keep moving, but we're testing more, and didn't get an answer. Then I will listen back on it. But if that's what we're waiting for, I think that is a huge mistake. And I have to put it out there that we have to start talking about our plan now on reopening so people have clarity in their lives.
Chairman Bishop, Supervisor Angus, and correct me if I'm wrong again, but my understanding is the governor has not officially put forth a plan per se, that he was, as of last week, collecting information from members such as yourself around the state to determine what that next step will be. Is that correct? I mean, I understand that the White House has their plan, and that included that gating criteria that I listed. And then the governor will
Don't you think we have enough information to start talking about it, though? And if that is the case, so you're saying that we need, how many are those tests? Like you're saying we need enough tests for everybody. Well, how many is that? And how are we going to get it? And what's the timeline to get it? So I think the earlier we start talking about those specifics, the better it will be when the time comes, and then we can hit it running instead of, just waiting. It's like we're waiting around. I guess what I'm saying is I think we have to be more proactive here.
Thank you, Supervisor Angus. And I think Denise has put forth a draft plan to do just that. And we received that last week, I believe, but it was still in draft format.
And also understanding
But why aren't we, as the Board of Supervisors, doing it? We are the elected officials.
Did you want to make a motion?
No. I just wanted to put it out there. So I think we need to, at least in our next meeting in a couple of days, that we need to start putting it out there instead of saying, well, we got a draft, we got this. We got to be more proactive. That's all I'm saying. I'm not ready to make a motion. I'm just saying, as a board, we must be more proactive. That is my stand, and that's all I got. Thank you. Thank you very much.
Okay, Supervisor Watson.
Thank you, Chairman Bishop. Ms. Burley, because Bullhead City and Lake Havasu City are experiencing lower numbers, would it be logical, because of the invasions from Nevada and California each weekend, to relax the protocols for those two communities and try to keep Kingman within the protocol? Is that a possibility, or is that anything that we've checked into, examined?
Well, I think, so when I put together the plan that you asked me to put together and draft that, part of that is, of course, looking at the White House plan and looking how our plan might be slightly different and modified from that. But, I also recognize that we'll work with what the governor moves forward with. So looking at whether or not there's any flexibility in his plan on a county-by-county basis or community-by-community basis, and I'm not sure where that stands. So I understand where Supervisor Angus is coming from. I love to plan. I prefer to plan and have those kind of milestones or markers where we can start to act on certain things. But at this point, I also think that while we're waiting on that, We also know that I think because Kingman's had a more robust testing program, we don't have that more true picture in those other communities. Because they have a robust testing program, you could probably argue that we have more cases. So,
Thank you. In our communications to the governor, we may want to propose those ideas to open economies that are less affected, that we're more positive. But at this point, because we're not positive, because of the low testing in those two communities, we should probably hold our ground. So thank you.
And Supervisor Watson, piggybacking on that, I have received communications that I forwarded to you, Denise, from Dolan Springs. They believe they have no cases in Dolan Springs, and they want their VFW, their American Legion, and their churches to be open. And I think there's been some concerns with the Meadview community as well, that they're not affected by any of this. And I don't know that they're not affected because we're not getting specific community locations other than zip codes. But I just wanted that on the record, that each community is an individual community with their own personality and their own needs and desires. But as a county, I think we need to stand united, and I don't know that we can take Bullhead City and Lake Havasu out of the equation and keep Kingman as an individual entity for different regulations for opening up the economy. But I don't know.
Madam Chair?
Supervisor Angus.
As I understand it, Bullhead, all the cities, they have their own elective boards. They can do what they want. I'm actually having a meeting with Bullhead City today because we are seeing it. We talked about Davis Camp. We're seeing it. So if it goes to follow that, if they weren't social distancing, we should be seeing a run of positives in Bullhead, but we're not. So I don't think, I just wanted to get it on the record that I don't think that we all have to wait and all do it together. I don't think we have been, frankly.
Madam Chair, Supervisor John.
Supervisor Johnson, go ahead.
I thought of a couple more things here. One of them was if we could get some kind of clarification. Ms. Valentine at last meeting threw me a curve on basically saying it was a contact spread virus. Everything I'm seeing is showing that there's still debate. Just as of yesterday, there was a report that was published and it talked about the new coronavirus appears to linger in the air in crowded spaces or rooms that lack ventilation. Researchers found in a study that buttresses the notion that COVID-19 can spread through airborne particles known as aerosols at 2 hospitals. Now, these are in China. You know, we can take that for whatever we want, but researchers found bits of virus genetic material floating in the air of hospital toilets and indoor space housing large crowds and rooms where medical staff take off protective gear. And this study was published in the Journal of Nature Research. Now, they're still saying that they don't know for sure, but they're saying that people produce 2 types of droplets when they breathe, cough, or talk. Large ones drop to the ground before they evaporate, causing contamination mostly via the objects, as Ms. Valentine said. Smaller ones, those that make up aerosols, can hang in the air for hours. They're talking about areas that, like restrooms, where they have less circulation. It can build up for the nursing staff and those who are changing clothes in one room. It falls off their clothing or gets airborne off their clothing and things like that. Ms. Valentine was pretty positive on the fact that it didn't. Are we still saying that it doesn't get aerosol?
This is Lynn Valentine. I'm not familiar with those, that literature that you are referring to, but as it stands right now, the belief is that it is droplets. It's via droplets. which is a form of airborne, because just as you said, it's, somebody sneezes or coughs and the droplets are released. And, they fall on surfaces, or they land on somebody else's mucous membranes, and that person can become infected. But as far as, that is the current belief right now, that it is droplet spread by a person, infected person's respiratory secretions.
All right, so there still is a division among the scientists and doctors and stuff over aerosol spread of the virus?
I think there is still research being done, yes.
Thank you. The last thing I have, Madam Chair, is in relationship to Supervisor Watson and the invasion of the Californians and Nevadans. The one thing that bothers me is that they're coming over here and they could be depleting our supplies of food and paper products from our stores also, where we have a harder time getting the supplies in. That's all, Madam Chair. Thank you.
Okay. Does anybody else have? Supervisor Gold, go ahead.
Thank you, Madam Chairman. I think it's essential that we begin to plan to reopen up the county. Americans and Arizonans are free people, and they're not going to tolerate being locked down much longer. And in reality, with the invasion of Californians, I don't believe that Mojave County sitting in their houses while Californians run around our towns is really going to keep the virus from spreading. So we better start planning on how are we going to handle restaurants, how are we going to handle other types of businesses, because we need to open this up and get back to work.
Okay, Supervisor Gold.
Thank you.
Did you want to put together a workshop? Is that what you're saying?
Well, I actually think it's for the health department to figure out how are we going to handle opening up restaurants and things like that.
Supervisor Bishop.
But if we sit around and wait, then whatever comes down from the governor is going to catch us by surprise. And as far as the federal government, they have no say in how we do this because of enumerated powers of the United States Constitution.
So we did receive a document from Catherine's Landing leadership, and it was specific to Catherine's Landing, but it had some really, really nice, accurate information in it that I think could help just about any business. So I asked our EH manager to revise that and take out some of the specific mentions that would relate only to Catherine's Landing's circumstances. And he has almost finished that document, and I do think that would be worthy of sharing with local businesses to help them understand how they might prepare and to take those steps, what would be necessary. It's maybe not all-inclusive, but I do think it's a good starting point. So we'd be happy to share that with you. We'd be happy to share that with the chambers and any other organizations that you see fit, so that we can have people thinking about these steps that they can take on their own to prepare.
Thank you, Denise. I appreciate that, and that sounds like a great idea. And I also wanted to take a moment to thank you and your staff for the hard work and long hours that you've been putting in.
Thank you. I appreciate that.
Yeah. Thank you very much. Supervisor Watson.
Thank you, Madam Chairman.
Thank you, Chairman Bishop. Ms. Burley, will that document be available for the Thursday meeting?
Yes, it will be. Yes. I can share it before that meeting if you'd like to review it. It would be, I haven't looked at it since Ron took it over, and I'm sure he was doing a fabulous job with it and really just removing anything, like I said, that was specific to Catherine's Landing, but they did give us permission to use this document in any way, shape, or form, and all the information in it to ensure that we can provide kind of some information out to our community and business owners on how they can prepare.
So let me ask you another question here. So I'm on the right page and in the correct lane. Let's say, for instance, a barbershop was interested in opening for clientele. So we could set forth guidelines and in which they could open their business at some point in time, whereas they make appointments for people to come in, and if it's a large operation, each could be separated by 6 feet or 10 feet or something like that. And then some type of sanitation requirement after that, sanitizing after each customer, or is that kind of the direction that we're headed on that document?
It is. It's a fairly general document that talks about how to keep surfaces clean and what to use, what products, and I'm not sure that it has a great deal of information about the social distancing, physical distancing piece, but it could either be added or just even a slide that says, within your facility, this is what you would be hoping to achieve. And businesses could look at that and decide whether or not they can fit within that. Some businesses really can't. I mean, I'll take, for an example, a barber, right? And some of these more personal services where you just have a one-on-one interaction with somebody. And some of those might be more difficult. It doesn't mean they can't be done, and there might be other steps that they could be taking other than physical distancing to try to help with that process.
Right. I'm just trying to see the logic in our direction, having gone to several grocery stores over the weekend and experiencing some anomalies to our protocols. And so if we're accepting some deviations from people that are shopping for groceries, but we're still insisting on other businesses being closed, I think it's a pretty unfair situation to be in.
Right. Yes, I
So,
definitely
thank you.
understand that.
Okay, thank you very much, Denise. Mr. Hendricks.
Madam Chair?
Go ahead, Supervisor Angus.
Okay, just real quick, while we were on this call, I got a question from a doctor asking, can Denise report the number tested at each hospital? If people can see the total number tested at each location, it would be helpful. And I think I've seen that, but it's not, I don't know if it's a public document. Is that something we could share?
It is, and here's my concern, and this sort of circles back to last Thursday's meeting where we talked about testing numbers, is we can certainly report out by hospital. Those particular agencies, those 4 hospitals in our county and North Country report to us daily on what their testing looks like, you know, the number of tests performed, pending, et cetera. The danger is that it's not all-encompassing, and that's been our concern all along, is when we provide you with numbers, we're giving you numbers from sort of the major players in this testing piece, but it's not a complete picture because there are a lot of smaller clinics and private providers that are testing, and they don't report those numbers to us. So when you see discrepancies in testing numbers, that's what it is. So we can certainly, if with permission from the hospitals, and I don't see that there would be an issue, but I'd like to check back with them, we can report that information to you for those 4 main facilities, and North Country Healthcare reports to us only once a week and not every day. So we would only be able to report those on a once-a-week basis.
Was there anything else, Supervisor Angus?
No, thank you very much, and I want to reiterate what Ron said. I want to thank you and your staff for doing a fantastic job during these extraordinary circumstances.
Thank you very much. We definitely appreciate that, and we appreciate all of your support in all of this because we realize you're getting a lot of questions from your constituents, and we want to be as readily available as possible to answer those, but hopefully we're doing that in a timely way. But I realize some may have fallen through the cracks, and if that's the case, please circle back with me and make sure that I've come back around to answer those.
Hey, Mr. Hendricks.
Yeah. Thank you, Madam Chairman. If you do get permission from the hospitals, that information can certainly be qualified, and you can put an asterisk down and say, we're only getting information once a week from the Canyon facility. The question I wanted to pose, or just a very quick discussion regarding the rapid testing. You know, previous to this machine coming out, you know, the county wasn't involved in the testing process, which I was somewhat thankful for, because it received quite a bit of criticism. Whether it was justified or not, I don't think it was, because all of our great facilities and providers were doing the best they could with what they had. And now it appears that we're getting a machine, and yet the number of tests are severely limited. So it would invoke some criticism from us being involved. My question is, how was the decision made to interject ourselves, Mojave County, into the testing process?
I think because we can target specific populations, like the long-term care facility, and try to more rapidly test people than maybe what the hospital can accomplish or the facility themselves can accomplish. So it's
So
going
was
to be...
the decision made internally, or was it directed to us by the state or by the feds?
No, it wasn't directed to us. We were given the option of accepting a machine, and we saw the opportunity to increase testing within a specific population and to help with with spread that way within those facilities, and that seemed like a good opportunity for us. If given an opportunity, if there was an area in the county that did not have rapid testing, we could provide that kit, that machine to them, and they could do rapid testing in their community also, separate from us. We don't have to be the holder of that. We can actually loan that machine out to a facility, and then they can do the testing.
Thank you, Madam Chairman.
Okay. Any other comments or questions? All right, Denise, thank you very much. I think you're doing a wonderful job, and I think we all want to reopen the economy in Mojave County as well as the state of Arizona. So hopefully our numbers will begin to go down, and we can get a plan together and we can make this happen.
Absolutely. Thank you.
All right. Have a good day.
You too.
Okay, going on to item number 2. Discussion of possible action, accept the invitation from the U.S. Fish and Wildlife Service for Mojave County to become a cooperating agency in the development of the supplemental environmental impact statement to the 2014 environmental impact statement for their proposed revision of the regulation of the non-essential experimental population of the Mexican wolf, and authorize the chairman to sign a letter to the U.S. Fish and Wildlife Service notifying the agency of the county's acceptance. Further, authorize the chairman to sign the memorandum of understanding between U.S. Fish and Wildlife Service and the Mojave County under inclusion of the recommended changes from Development Services.
Madam Chairman, I'd like to make a motion for the acceptance of the invitation, although I will make this comment. Having dealt with the U.S. Fish and Wildlife Service a number of times over many issues, the cooperating agency portion of that is quite a misnomer, but for the expediency to get this information out, I'll make a motion for approval.
Okay, do we have a second?
Second.
Okay, we have a motion and a second. All those in favor say aye.
Aye.
Any opposed?
Aye.
Aye.
Motion carries. Okay, we are adjourned.